I still think we should have a bipartisan solution, but what I can't tolerate is a government plan, and there's no way you can make it co-equal, have a government be on an equal playing field, because they have, the government basically, if we turn over this country's health care to a government plan, and we open up a government plan, the Lewin Group, one of the best analytical groups in health care in the country, if not the best, said that up to 119.1 million people would transfer from private insurance into the government plan.
Well, Senator
happens,
Hatch, we should point out, first of all, the Lewin Group is owned by UnitedHealthcare, although they insist
fine, but they're
editorial.
still highly respected.
Yeah, I'm not disputing that. But let me ask you a question.
Respected.
You are one of the chief co-sponsors of the state children's health insurance program, bringing health insurance through the government to millions of children. You've been heralded for that by liberals. At the time you introduced it, then Senate Majority Leader Trent Lott accused you of creating big government. What's the difference between the S-CHIP program on a theoretical basis in terms of getting the government involved and what you're now talking against?
The way it was originally designed, it was the Hatch-Kennedy bill. We wrote it together, and I have to say that that plan basically provided block grants to the states for the states, according to their own demographics, to set up their own child health insurance program. It worked amazingly well until the liberals started to push more and more Medicaid people into the CHIP program, and started to expand the CHIP program in ways that were never contemplated. We did CHIP for the only kids left out of the health care system, children of the working poor. Now it's being used to push Medicaid people into it, and everything the Democrats are doing is pushing towards what's called a single-payer system, where the government basically controls everything. And this public plan, this public government plan, don't think for a minute that that will not destroy the current insurance system. 8 out of 10 Americans are basically pleased with their health care insurance. They'd like to improve it. They'd like to make sure that they have guaranteed issue and that people with pre-existing health care problems are taken care of. And we all want to do that. And 64% of them say they'd prefer that over a government plan.
Right.
And yet we're just pushing like mad to get a government plan here.
79% of the American people do say, though, that their premiums are too high. They pay too much. We only have
they all agree with that.